Question 1. A 25-year-old man is stung by a bee and within minutes develops widespread urticaria, hypotension, and wheezing. This reaction is best explained by which of the following immune mechanisms? A. Formation of antigen-antibody complexes and complement activation. B. Cytotoxic T-cell mediated destruction of host cells. C. Mast cell degranulation triggered by IgE cross-linking. D. Activation of macrophages by interferon gamma. E. Direct antibody attack against cell surface antigens. Correct answer C. Mast cell degranulation triggered by IgE cross-linking. Type 1 hypersensitivity involves antigen-induced cross-linking of IgE on mast cells, leading to degranulation and release of histamine, leukotrienes, and tryptase. Incorrect options. A. Type 3 hypersensitivity, e.g. serum sickness. B. Type 4 delayed hypersensitivity, e.g. contact dermatitis. D. Macrophage activation is more relevant to cell-mediated immunity, type 4. E. Type 2 hypersensitivity, e.g. autoimmune hemolytic anemia. Question 2. A woman with a peanut allergy accidentally consumes a peanut-containing dessert and develops anaphylaxis. Which of the following is the most appropriate immediate treatment? A. Intravenous diphenhydramine. B. Subcutaneous corticosteroids. C. Intramuscular epinephrine. D. Oral leukotriene inhibitors. E. Inhaled beta agonists. C. Intramuscular epinephrine. Epinephrine IM is the first-line treatment for anaphylaxis. It acts by vasoconstriction, alpha-1, bronchodilation, beta-2, and reducing mast cell mediator release. Incorrect options. A. Antihistamines are supportive but not life-saving. B. Corticosteroids are used to prevent recurrence, not for immediate rescue. D. Leukotriene inhibitors are slow-acting. E. Inhalers help asthma symptoms but do not reverse systemic effects of anaphylaxis. Question 3. Which of the following is most likely elevated in the immediate phase of a type 1 hypersensitivity reaction? A. IgG. C. IL-2. D. C5a. Correct answer B. Tryptase. Tryptase is a protease released from mast cells during degranulation and is a reliable marker of mast cell activation, especially in anaphylaxis. Incorrect options. A. IgG is not involved in type 1, more in type 2-3. C. IL-2 is associated with T-cell proliferation, not allergy. D. C5a is part of complement activation, type 3. E. TNFi plays a role in inflammation but not specific to mast cell degranulation. Question 4. A 10-year-old boy with allergic asthma experiences recurrent wheezing, especially during pollen season. His symptoms are driven by eosinophil infiltration and late-phase inflammation. Which of the following medications would most directly block the late-phase reaction? A. Inhaled albuterol. B. Systemic corticosteroids. C. Epinephrine. D. Oral diphenhydramine. E. Anti-TNF therapy. Correct answer B. Systemic corticosteroids. Corticosteroids suppress cytokine and chemokine production, eosinophil recruitment, and inflammation, making them effective for the late phase of allergic asthma. Incorrect options. A. Albuterol is a bronchodilator, not an anti-inflammatory. C. Epinephrine is for acute anaphylaxis, not chronic asthma. D. Antihistamines block histamine only, early phase. E. TNF is not the main driver in type 1 hypersensitivity. Would you like a visual chart summarizing all 4